from a clinical evidence generation perspective, could you speak a little bit to before the pandemic, some of the sort of best practices, and then how you've seen things adjust from the pandemic? And you just talked about some of the things that you've changed to get more from a remote standpoint, but maybe even give us a percentage of what that looks like before and after.
Sure. Sure. So from an evidence perspective, I think we've gotten better at looking holistically at not only a development view that says, hey, we think we have an unmet medical need, or we think we have a opportunity to improve our device. And so this is the study we want to do to prove that.
Okay.
I think we've gotten better at the voice of the healthcare provider and the patient in that scenario.
Okay.
Taking into account what patients are telling us, what do they see as features that we can improve? What do they want from their perspective? What are healthcare providers seeing and hearing? At least in my short tenure here, it was not a large aspect of what we did, but it's getting bigger. Okay, because I think the two factors. One is patient voice has a bigger say now, and in continuing to go that way. And I think patients have choices. And not all the time with devices will they have the choices, but I think they're getting more choices and they can influence more from the healthcare provider perspective. And so listening to what matters to them, I think is going to really be important for us. You ask about kind of post-pandemic and all that activity. When the pandemic hit, we were 100% remote. I mean, everything was done remote. I think we're starting to take back up a little bit. From a clinical execution perspective, but a lot of our CRO partners that we work with and a lot of our internal staff are still working remotely, either by their choice or by the choice of the institution that they would be going into, hospitals, offices.
Depending on what state they're in as well, I'm sure plays into that.
Yeah, absolutely. So it's a really complex situation and one that I didn't probably fully understand as we were going into it, just the operational challenges that it would play out as the whole infrastructure of healthcare kind of got impacted by the pandemic.
Yeah, it's certainly been a challenge in a lot of different ways. One thing that you said that I'd like for you to speak to a little bit more is from a usability standpoint, usability factors and studies. And you look at the last 10 years, it used to be your systems engineers, they wanted to kind of try to fill that particular skill set as well. And it's become its own entity, where it's a lot of opportunity there. How is that paradigm shifted at Baxter, and what's your system look like in terms of from a usability standpoint and how you tie those? Do you have a complete group? Do you contract that piece out?
I think it's a mix of approach. It's certainly, as you point out, a huge factor as we roll out the next generation of devices or advancements in devices. Usability is huge. Obviously, we do a lot of use testing, human factor studies that help us get insight into how things are being done. But at Baxter, we have a pretty big mix of products. It's probably the first company I've been at where it truly is a very, very broad spectrum of products. And so I think it just depends on what area we're in and how much advancement's happening.
Yeah, that makes sense.
Hear me, would you speak to me when I open up? And I forward my thoughts to you, but sometimes I'd say you're thinking too much, and I don't want to hide on this.